Good afternoon and good morning to you if you are on the West Coast. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health and Public Housing. Thank you for being with us and attending this live activity, this live webinar, Secondary Traumatic Stress Identification, Mitigation, and Improving Work Satisfaction for Healthcare Staff during the COVID-19 pandemic. This is a live activity. At this moment, all lines are muted. We are going to have a Q&A session at the end. So if you have any questions, please save your questions and you can use either the chat box or you can use the raise hand icon and your line will be unmuted. Next slide. Before we get started, there is a post survey. Please take some time and give us feedback. It's very important from us to hear from all of you on new topics and how we're doing with our activities. Next slide. We are the National Center for Health and Public Housing, and we are funded by HRSA to provide training and technical assistance to health centers, with special emphasis to those located in or immediately accessible to public housing. Next slide. There are 107 public housing primary care grantees, and in 2018, they provided healthcare services to over 800,000 patients. In 2018, 385 health centers reported to be in or immediately accessible to public housing, and they provided services to over 4 million patients. Next slide. There are around 2.2 million people living in public housing. 38% of those living in public housing are under the age of 17. 59% are female, over 80% are below the federal poverty level, 52% are white, 43% are African American, 25% Hispanic, and 38% of them reported one or more disabilities. Next slide. Quick overview about the chronic medical conditions affecting those living in public housing. You know, diabetes is HRSA priority, and those living in public housing are almost 2 times more likely to have diabetes when you compare them to the general population, and they have higher risk for other chronic conditions such as COPD, asthma, being overweight or obese, and almost 36% of them reported to have fair or poor health. Next slide. We've been since December 30th or December 31st when we heard about the first COVID case in China. Since then, around the world, we have been seeing how healthcare professionals are being affected by the COVID-19 pandemic. The sources of anxiety reported by some of the by some of the healthcare workers around the world are that they do not have appropriate access to personal protective equipment. They have concerns about being exposed to COVID-19 at work and taking the infection home to their family. They are concerned about not having rapid access to testing if they develop COVID-19 symptoms, uncertainty that their organization will support or take care of their personal and family needs. They are concerned about support for other personal and family needs as work hours and demands increase, being able to provide competent medical care if deployed to a new area, and lack of access to up-to-date information and communication. Next slide. I would like, as an introduction, to mention two recent surveys conducted in two different countries. The very first one is regarding the psychological impact of the COVID-19 pandemic on healthcare workers. And the first one, basically the response was over 1,200 who participated, and the participation rate was almost 69%. 68% of them were nurses and 32 of them were physicians. And as you can see, depression, anxiety, insomnia, and distress were the main psychological symptoms or condition reported by healthcare workers. Next slide. There is another one. This was conducted in Italy, and as you can see, basically they are reporting the same kind of conditions or disorders, PTSS, depression, anxiety, insomnia, and high perceived stress. So what we're seeing in the United States is similar to what we are seeing around the world and what healthcare workers are experiencing around the world. Next slide. This is information from the Journal of American Medical Association about the request from healthcare professionals to their organizations during the COVID-19 pandemic. This is a very interesting slide, but I would like to focus only on the request from the healthcare providers, the needs that they have: hear me, protect me, prepare me, support me, and care for me. Those are going to be the topics of discussion that we are going to have from the two panelists that we have invited today. Next slide. This information is on our website, nchph.org, and it's taken from what health centers are reporting from, are reporting to HRSA. If you would like to get updated information on public housing primary care, please visit our website, www.nchph.org. Next slide. And I am very pleased to introduce our two panelists for today's presentation. First, we are going to hear from April Natural. She is a traumatic stress specialist with 30 years of experience as a health and mental health care administrator and a clinician specializing in response to traumatic events. After 9/11, Dr. Natural directed the New York State response to the World Trade Center disaster, served as a project director for the Substance Abuse and Mental Health Services Administration's Disaster Technical Assistance Center, helped launch the National Suicide Prevention Lifeline, the BP Oil Spill Distress Helpline, and the National Disaster Distress Helpline. She was the architect of the Boston Marathon bombing behavioral health response and has been assisting in program development efforts and needs assessment surveys, as well as victim, family, and provider forums for San Bernardino, the Las Vegas Harvest Festival, Pulse Nightclub, Parkland, Thousand Oaks, Pittsburgh Tree of Life, Virginia Beach, El Paso, and Highland Ranch shooting incidents. She's also currently training psychologists in the Ukraine military service and humanitarian aid worker for the European Union. Next, we are going to hear from Sarah Allman. She has dedicated her professional career to improving behavioral health among the most vulnerable among Northwestern New Jersey's residents. Serving as Sioux Director of Behavioral Health since 2018, she's been deeply involved in Sioux Health's integration of behavioral health within a patient-centered medical home model. Since 2010, Sarah has worked as a direct service clinician as well as a leader within the health center around mental health services, offering training and support to behavioral health staff as well as other Sioux employees and clinical providers. She has played an important role in many new behavioral health initiatives and is working with senior leadership as well as the rest of the health center to continuously improve evidence-based practices at the health center. Current focus for the behavioral health team includes telehealth services, integrated care including brief therapy and assessments, and developing a trauma-informed approach at all levels of the health center. So I would like to turn it over to April. Good afternoon, April.
Good afternoon, Dr. Leon, and thank you so much for the invitation to be here today with our colleague, Ms. Alleman. It's an important topic, and of course it's timely, and I suspect it will be for quite a long time as we move through all the variations in how the pandemic is affecting all of us, but especially our healthcare providers who are in this for the long haul. We're very concerned for all of those who are responding to the COVID-19 pandemic, but as we know, there are those healthcare workers who are continuously exposed to the possibility of becoming sick themselves. And we know in any kind of emergency and disaster that there is a significant number of population who are responders and those who are exposed who might suffer with secondary traumatic stress. So we're going to be looking at how we can identify secondary traumatic stress and compassion fatigue, as well as burnout, another concept that many of you are familiar with. And we'll be trying to identify these so that each of you know what to look for. And we'll be talking about ways to mitigate this becoming a chronic problem. Sorry, I was having trouble moving the slides. Here we go. So we're going to identify compassion fatigue and secondary traumatic stress. These two terms are probably the most common that are most like each other. And there's a slight difference between these and vicarious trauma and a very significant difference with burnout. So we're going to look at those definitions. Then we're going to talk about how healthcare staff can participate in stress management assessments for themselves, for their organization, and look at how to mitigate, right? How to avoid developing severe stress reactions, and also to improve worker satisfaction, because healthcare workers are some of the most dedicated professionals in any area across the country. And so we want to make sure that we're helping to keep them strong and well so that they can do the work that they need and want to do to help others. And I'm going to talk about and introduce really a cognitive strengthening preparedness program to give people an idea of what they might be able to do to help themselves as we move through this. So this is a slide for your reference to give you an idea of what some of the symptoms might look like in CF, which is compassion fatigue. Many of you have heard of this before. One of the primary issues there being exhaustion, overworking, and moving into some depression-like symptoms, including helplessness. And then an unusual type of symptom that we don't see in a lot of other professions, but we do see in healthcare workers is this obsession with helping. In other words, an inability to stop working. Secondary traumatic stress looks more like the same symptoms that somebody with post-traumatic or acute stress might have. The symptoms tend to parallel that of their clients, like intrusive images, nightmares, flashbacks, and of course fear, which is what is the primary symptom that gets set off when we're afraid for our life that we might be hurt or killed. And then we see a lot of avoidance, and in more serious or chronic conditions, we see helplessness, and we see this might even turn into post-traumatic stress disorder. You'll hear the term vicarious trauma a lot, and it's a little bit different than the others in that it can create in the person who's suffering with this negative cognitive schemas. That means that the worker might have a really negative view of the world, of their life, of their profession, of how they're managing in the world, and it can really cause some serious depressive-like symptoms as well. Some people will question their spiritual beliefs or their beliefs in general. And vicarious trauma can actually cause this sense that there's no place that's safe, often resulting in a change in the worldview, which can be obviously very serious and cause people to question mostly their personal and spiritual lives. I did want to make this differentiation with burnout, though, because burnout is something that generally doesn't have to do with taking care of our clients and our patients, but it often is a result of the administrative problems that people have within the organization. They're frustrated with their administrator, they don't like their supervisor, or they don't get what they need from their supervisor, they don't get along with peers, or they disagree with policy. And so the two differences with burnout too are in that instead of this obsession with helping like you see in compassion fatigue, In burnout, people tend to become indifferent, more and more mental health days or sick days, or looking to leave the profession altogether. So we're very concerned that we don't want these symptoms to turn into burnout. We don't want to lose healthcare workers who've worked so hard to become the professionals that they are, and they're certainly needed in our society in this time of the COVID-19 virus. On the bottom, you can see there's some shared symptoms. Unfortunately, as all of us across the nation know, we're seeing an increase in substance use and misuse. We see a lot of relationship problems. We've certainly seen that after some of the large-scale disasters that we've had across the country in the past 10 years. And interestingly enough, we also see increased rates of physical illnesses like high blood pressure and a weakened immune system. So we're very concerned about all of these symptomatologies that can arise because of the stress that the workers are dealing with on a regular basis. This is from the CDC's Disaster Mental Health Responders, Key Principles, Issues, and Questions. And I'll bet many of you who are looking at it can identify some of the sources of stress that you experience in your agency. Role ambiguity and lack of clarity of tasks, lack of team cohesion. These are very important things that tend to bother people and cause them a lot of stress. Again, separate from taking care of the patients or the clients. Then we have some of the issues that we've heard across the country since the COVID pandemic has been exposed, with ineffective communication, not good information, waiting for clearance to be able to use some of the different types of interventions that you need. And again, things like equipment shortages, not having your PPE, not being able to access the safety conditions that you need in order to do your job. Then we look at other issues that also can add to these stresses. When people are out sick and you're having to pick up others' work, or maybe you go home and nobody really understands what you're going through and they invalidate your experience. As we mentioned earlier, we do see a lot of domestic or family conflicts or issues when people are so distressed and unhappy and experiencing some secondary traumatic stress or vicarious trauma. And of course, what we hear from all the healthcare workers that it's almost impossible to implement self-care. So instead, they might start doing things like self-medicating, which we've heard is a large problem, and not a new one, by the way. We look at healthcare professionals and their exposure. It's like they're in this constant state of trauma. The difference between COVID-19 and other kinds of emergencies and disasters is that when an incident happens and we have the fear response, right, the fight, freeze, or flee, that usually settles down after the immediate emergency passes. The problem with COVID-19 is that we are in this continuous enhanced state of fear, having that fear response. And so we're exhausted by this flood of toxic hormones that are moving through our bodies and trying to protect us and trying to tell us what we need to do to take care of ourselves. Now, healthcare workers are the grittiest group across the country in any profession. We tend to constantly be working with multiple patients with trauma, serious injuries, having to go through life-saving efforts often, and staying at work for very long periods of time. And so while you're generally self-reliant and want to be giving support rather than needing it and not showing any weakness, this can cause a real problem with not being able to identify your own secondary traumatic stress or vicarious trauma. In addition to that, stigma around behavioral health concerns are as strong in the behavioral health discipline as they are in every other discipline. As a matter of fact, healthcare workers tend to hide things even more so, because while you bring individual skills to your work, you're often working in teams. And so it makes it very difficult for healthcare workers to say, hey, I need to stop or I need help. And we need to pay attention to that and provide the type of structure and the type of supports and tools that healthcare workers can implement in their daily work and then in their personal lives when they go home. Even though they don't see themselves in need of mental health supports when they're working in these extreme stressful environments, we need to be able to introduce the idea that they can express their concerns and get their needs met. They're always covering some others who are out looking at putting on extra shifts. It's a group that you're very hard on yourselves. And often you hear healthcare professionals say that what they're doing is never enough. If you're one of those healthcare professionals who's done a good job taking care of yourself, I congratulate you, but you're not the norm. This is a group that we need to pay attention to, look at how we can help overall. So let's first look at some of the risk factors. You see in the professional area, they're existing in the personal and physical areas that can create a higher level of risk for experiencing secondary traumatic stress, which I'm going to use probably throughout the rest of my presentation just to make it easier. Providers who see a high number of trauma cases, which is almost everybody at this point, especially with the COVID patients coming into the healthcare centers. Those who have a lack of specific training so that they don't feel confident in what they're doing, and those who are fairly new and have not just had the experience of working with trauma cases are those who are at higher risk. Even if you have the perception that you don't have adequate training to provide the level of care needed, can create symptoms. And we're certainly seeing that with COVID-19. It's such a tricky virus. We're not understanding it well. And of course, as we've heard across the country, not having adequate PPE is a major stressor. On the personal side, providers who have a history of trauma experiences themselves, such as child abuse or neglect, or interpersonal violence like domestic abuse, rape, or a physical attack. These people who've had these experiences may be at higher risk for secondary traumatic stress than those who don't have those experiences in their history. People with good social support, without good social support, people who isolate themselves and don't use good coping skills or use negative coping like alcohol or other substances are certainly at higher risk of suffering with secondary traumatic stress, vicarious trauma, or burnout. And then just some physical factors that are important to look at. We know that blood pressure is often twice as high during the workday as compared to at home or not. The worst related work stress is caused by jobs where people have little control over the activities and the rate that they have at which to deal with them. So we certainly see that in healthcare and emergency room settings. And then race is also a factor. Family genetics, different illnesses that are passed down, and our high fat and high salt diet in the US certainly contributes to problems like high blood pressure and obesity. Being a professional caregiver with children is often more of a stressor as well. So there are a lot of things that can add to someone's risk factors in developing secondary traumatic stress. These are some of the symptoms that we see. Often we see a lot of these different symptoms across the different domains: physical, emotional, personal, spiritual, and then those from the exterior, the workplace. Most commonly being a rapid heartbeat or panic attack, then headaches, stomach aches, and sleep issues, either not being able to go to sleep or not being able to stay asleep. Of course, under emotion, we look at fear and anxiety, the top two, when there is a threat to one's safety or health in any way. Anger is pretty common, and of course, these symptoms of depression-like symptoms when we're experiencing such fear. Helplessness and depression can turn into hopelessness. These are some of the red flags for suicide, so we're very concerned about them. And as I mentioned before, not having social supports. Isolation is a big red flag for having a higher risk of suffering with secondary traumatic stress. And as we mentioned before, alcohol and substance misuse. What you see played out in the workplace is often a lack of motivation and lack of staff morale, some absenteeism, when they've already developed some of these problems. As I said, in the early phases, you see people having difficulty stopping work. They will continue work all the time. But when you see them starting to develop STS, you'll start to see some of the avoidance and the absenteeism. The professional and interpersonal effects of secondary traumatic stress can look like many different things. As we said with the earlier reference, you can often see a loss of productivity and exhaustion. Then poor communication. We see poor communication in many areas that break down between staff and their managers and supervisors. There's a lot of increased conflicts. And again, in the early stages, you still see that inability to stop working and to become obsessed with helping. And of course, those who have a decreased confidence, especially if you're afraid because you're missing PPE or you haven't been properly trained in how to do something, we see this decrease in confidence, which can cause some real distress symptoms. We're very concerned about people who start to become detached. It's one of the red flags for post-traumatic stress issues. And then anything that takes them out of contact with good social supports. People stop socializing, and of course, in this age of physical distancing, that's happening to a lot of people. Coming after that, you see some of the loneliness, and then that kind of isolation can lead to a mistrust, or even sometimes for some people, a sense of paranoia and anger, which is usually a cover for grief or fear. And then a decreased interest in intimacy, and even for some, a negative impact on their parenting, which of course we're always concerned about. Other than post-traumatic stress disorder, some of the more serious problems that are common in the healthcare and other professionals include self-medicating, alcohol and opioids, as we've heard about, or anti-anxiety meds even. Others may self-soothe by overeating or excessive drinking. And again, relationship problems follow poor coping. We see high levels of extramarital affairs and divorce. And again, some of the high risk problems of helplessness, hopelessness, and isolation can lead to suicide thinking and gestures when people don't see another way out. These effects aren't pretty, and the real problem is that we as a profession tend to hide them by continuing or thinking that we're able to continue function well at work. Thus, many might not know that they have a problem, and we're pretty good at denial and avoidance in this country, unless, of course, it starts to become a real serious or chronic problem and has already destroyed our relationships, our work, and even our sense of self. There is, however, good news. There's ample satisfaction and meaning in the work that we do, and that is very, very powerful. We need to recognize that the reason we come into these helping professions is because we want to feel good about the work that we do. We don't necessarily have to experience only negative stress in this work. We can gain a very positive energy, or what we call compassion satisfaction, the sense of doing something meaningful, being happy about that, and feeling useful and connected to others and to our community. We know that many people in healthcare professions report what we call post-traumatic growth, or just traumatic growth. That is, we can learn and grow from witnessing and experiencing trauma, the trauma of our own selves, our families, the trauma of our clients and patients. Some people learn to appreciate their relationships more, others learn good coping skills, and others report feeling more grateful for many aspects of their lives. So providing the type of care that you do, listening and supporting your patients, your clients, and their families can lead to a tremendous sense of strength, self-knowledge, confidence, a sense of meaning, spiritual connection, and respect for human resilience. So we can nurture these protective factors by looking for and recognizing them in our experiences, and even seeking opportunities to practice good coping, like supporting each other and having gratitude for the small positive things that happen every day. These actually can overtake the negatives. So consider what you're doing on a routine basis that might either contribute to or help decrease uncomfortable stress symptoms. Are you overcommitted? Have you taken on too much at work or at home or in your volunteer work? Also consider if you're particularly vulnerable. If you have a history of trauma in your past that still has strong negative effects on your life, or if you've had someone close to you die in the past year, or if you yourself have experienced a medical illness or been in a life-threatening situation like a car accident, these things can temporarily increase your risk. So you might want to look at making determinations about these situations. You've got to have a good sense of self-awareness. Are you someone who avoids looking at these issues? This may be a time for you to take a close look. What can you do to help yourself to get through them? Well, we're going to start with self-care, and just after I'm finished Sarah Ellerman will be talking about this more specifically, but I want to introduce this idea that we actually can maintain physical, emotional, relational, and spiritual health in times of stress. So those you don't know what self-care is, it's things that you do to protect and maintain each of these for yourself. And here we're really referring to your sense of overall well-being in your place in the world and in your profession. So we highly recommend looking at some kind of a self-care plan. Look at each of these aspects and write down 1 or 2 actions that address your needs in each of these. And I'll walk you through this in a little bit. Are you doing something every day, maybe even as simple as taking a walk, something that helps you to relax, that brings you joy? And more importantly than anything else, do you connect socially with those who you care about? Whether, of course, we now have to do this with physical distancing through the telephone or texting or writing. And what fulfills your spiritual needs? Volunteering for the food bank or driving someone to a doctor's appointment? As healthcare professionals engaged in emergency response, have you and your family been prepared to deal with this kind of an event? COVID-19 is certainly extraordinary in that it is global, certainly affecting us nationally is in and of itself larger than other issues that we've had to deal with, local emergencies or natural disasters that occur in our area. But it's still important for each of your family members to know what they need to do when you're pulled into long, intense days of work. Do you have a schedule of when to communicate with them? Have you arranged for care of your pets and plants as well as your children? All these things that we tell the public to do to prepare for an emergency should be things that we've practiced ourselves. Prepare yourself for coping with stress as well. Take a look at what this image shows us. We want to identify work stress. What is it that bothers you? Is it the unit clerk that doesn't do your filing for you? For somebody else, it may be seeing the children's oncology unit every time they go to their office. What is it that bothers you? Because what bothers you might not bother somebody else. What stressors are you aware of? What are your warning signs that tell you that you're starting to struggle? Do you start yelling orders at staff across the desk? Do you become impatient? Do you get a headache, pain in your shoulder? These are things that are warning you that your stress level's getting intense. And what are the first things that you do to address them? Do you go straight to negative strategies? And you want to be honest here. Does having alcohol every evening really relax you, or do you find it makes you wake up with a rapid heartbeat at 3 a.m.? Does yelling at the kids leave you alone because you're tired from work really make you feel better, or just guilty? Try and be as honest with yourself as possible. And then look at what are the positive strategies that you've used before that help. Can you review them and activate again in this time? Our recommendation is to look at the core 4, right? You need to know how much sleep you get. That will help you, whether you're a 6-hour, a 7-hour, or an 8-hour person. How much time do you need to get in a good night's sleep that will make you feel better? Physical body movement, one of the most important things that we can do because we need to get the toxic stress hormones out of our body. 10 minutes walking in nature, 20 or 30 minutes. Can you do that at break time? Do you allow yourself to do it at break time? And what kind of active mental relaxation are you able to engage in? Something simple like breathing, focused breathing, staying quiet, meditation, listening to calming music or guided imagery. Make yourself a playlist of music that's timed to a slow breath that you can listen to. There are all kinds of free apps that can help you with that. Calm, Insight, Timer, Headspace. Research shows too that social support and close relationships are good for our physical and mental health more than anything else that we can do. Make time to be in contact with those who support you. And that's people who understand and accept how you feel, not people who are invalidating your support. So stay with those core 4. Let's do a really quick, short leisure activity action plan. All you need is a pen and a piece of paper, or you can even do it on an electronic device. Write down 3 leisure activities that you enjoy. And that's things not related to work. And they can be anything, reading a book, taking a bath. What's going to be part of your go kit? Take these 3 leisure activities and write down the date and the time that you can perform them. And if you want to go really far, write them actually in your calendar once a week for a month. The research tells us when we identify things that calm us, when we write them down in the calendar, even if we don't carry them out or we have to move them, we're still more likely to do them than if we didn't identify what they are and put a date and time to them. And you can take planning even further. This is a nice exercise as well. Right in the middle is your goal. What do you want to accomplish? So say you want to lose 5 pounds. Okay, what are my current skills? I've done this before. I know how to do this. I know how to do meal planning. I'm a decent cook. I can cook good meals for myself. What are the skills you need to work on? Is it a better way to grocery shop so that you're not tempted to buy things that you don't want to have in the house? Then go down to your resources and people and tools. Do you have a buddy that can do this with you so that you can share information with? You have a program that you've used before that works. Can you pull that out again? And maybe introduce a new tool like some kind of exercise. And then start writing out and putting the date and time you're going to do this. What's your action plan? What's the first thing you're going to do? What's number 2 and number 3? It's a really simple exercise, but the research is pretty good on writing things out as helping them to be more successful. Another really important thing to look at for professionals especially is peer support. Peer support is emerging as one of the most helpful ways that providers can support each other. This comes from peers and colleagues who understand and accept how you feel. Start by identifying a buddy, someone who works in the same area as you, not someone who invalidates your worries. Peer support can be individual, but also really, really helpful in group settings, like group supervision, case conferencing, and work groups. It's really important to be authentic when you share your concerns with your peers. You can still keep confidentiality by not mentioning patients' names. Brainstorm problem solving with your peers. Hear their suggestions. And all peers should be from a place of mutual respect and equity. So there's no hierarchy. No titles are used in peer settings. Managers, supervisors, and line staff can all learn from each other. You want to check in with each other, especially your buddies, providing follow-up contact and supportive words or recommendations, and most especially after an emergency or a difficult incident with a patient or a client. Effective supervision has been found to be associated with lower levels of secondary traumatic stress and burnout, and higher levels of that personal growth or that traumatic satisfaction that we talked about. When you can, you should be able to vary your caseloads. I think we have this tendency in healthcare to give some of the hardest cases to our best functioning staff, and that doesn't give a lot of other staff the opportunity to learn and build their skills. We need to take that chance. And I think in this time of the COVID virus, I think that's more important than ever, because we need to build the capacity within our systems for everyone to be able to cope with and work well with those who are suffering, and to experience what they need to do to control their own anxiety and fears about working with the COVID patients. Another recommendation, of course, is practicing only within your role and your abilities. People tend to jump outside their role or their skills because they want to help in an emergency, and it's not a good thing to do. It may, in fact, be a sign that you're so distressed that you're distorting your judgment, which is not an unusual thing. So stick to the rules of your profession. Remember, it's a rare occasion when the rules don't apply. And if you find yourself thinking, well, this is different, it may be also a sign of poor decision-making due to stress. These are a couple of tools that you might access to help yourself: the organizational assessment, the stress audit checklist, and the ProQual 5 is the one I really want to point out, which is here on the right. You can just Google ProQual 5, and it comes up with a really nice, valid and reliable test that helps you to determine whether you have a high level of compassion satisfaction, compassion fatigue, or burnout. The scoring is broken into those 3 different subscales. The nice thing that I've seen in using this tool is that a lot of people do much better than they think they have been doing. And so it does boost their competence and their sense of confidence. So that's really helpful. And we recommend do these assessments 2 or 3 in a period of a quarter just to measure and see if there's any change. And I wanted here the Office of Victims of Crime a vicarious trauma toolkit, which has all of these tools and a lot of other suggestions for healthcare professionals and others who are working with victims of violence. The research is also very clear that those staff who suffer more with compassion and secondary traumatic stress are the ones who have the least amount of experience and training, including a lack of training in responding to emergencies and disasters. They need more orientation, basic descriptions of their duties, their roles, and responsibilities. We need to help staff have a sense of confidence and competence in their work, and that comes from proper training and supervision and support and feedback. So we'll take a quick dive into what I want to introduce to you so that you can go and explore a little bit further on your own cognitive strengthening program. We look at cognitive restructuring, which is the most evidence-informed tool that can support healthcare professionals as you develop ways to cope with the severe stress at work. These tools involve cognitive restructuring or reframing, attention diversion, mindfulness-based stress management, adaptive engaging, and adaptive affective expression. Here we show the stop, look, and reframe tool. This is one of the most important tools, and it's drawn from cognitive therapy, helping people to identify and challenge and then change stress-inducing thoughts, patterns, and beliefs. The goal is to help people replace the stress-inducing thought with more accurate and less rigid, and therefore less stress-inducing thinking. It's a very powerful therapy tool, and it's been adapted to help people cope with all kinds of stressful events. In cognitive restructuring, we identify and write down our disturbing thoughts, and this is really important to do because it's much easier to examine them when you've clearly identified them and written them down. Then you write down what was happening at the time of the thought, write down your emotional response, and then look at how to restructure it to stop and examine the original thought. Identify dysfunctional thinking or distorted thinking, look at different ways and situations that may tend to trigger certain negative thought patterns, and look at how you might typically experience anger or sadness in response to stress. So what kind of thinking might be a mistake about whether your thoughts have been wrong or maybe unconsciously experiencing a cognitive distortion. So a simple example is when you're overwhelmed, you think to yourself, I'll never get this done, I'm terrible at this. And if you identify this thought and recognize that it's not helpful, you can create a new thought such as, I'll focus on getting this work done, one task at a time. I'll do my best. That's the best I can do. And I can even ask for help if I need it. Sounds like a simple exercise, but it is one of the most highly evidence-based ways of helping to decrease stress and increase your sense of competence. We look at attention diversion, which is a very purposeful way of regulating our emotions. It's one of the gifts of human beings, our capacity for self-control and our ability to refrain from inappropriate behaviors. Attention diversion is one of those gifts. It's a tool that can be used to cope with very strong emotions that we might be experiencing in a distressing moment or a very difficult work situation. So it's one of our thinking skills that gives us some control. It allows us to engage better with others as well as to care for ourselves in a more productive way. It's basically purposeful distraction. It's anything you do temporarily to take your attention off a strong emotion. Sometimes focusing on a strong emotion can make it feel even stronger and outside your control. So by temporarily distracting yourself, you give the emotion some time to decrease in intensity and making it easier to manage. And a key part of the definition really is temporarily. Don't be avoiding it completely or escaping it for long periods of time. When the emotion has decreased a bit, you can return to the feeling and examine it more and learn how to reduce it even more so. and such as you can do other things such as expressive writing or talking to someone else as a way of bringing down the emotions. A lot of people have heard of mindfulness or meditation, but some still think it's a complex practice that's too difficult to use in your daily routine. There are many levels of mindfulness, and the research is telling us that when combined with the use of other-based interventions, it can boost positive effects. So if you're exercising and doing mindfulness, you'll get a boost. If you are writing, doing some narrative and mindfulness, you'll get a boost of a good positive effect. It's basically a great cognitive strengthener, and you get better with practice. Actually, any level of mindfulness is a good thing. It's just a simple state of being conscious or aware by focusing your awareness on the present moment and calmly and acknowledging whatever thoughts and feelings you have. And there are lots of ways, and you can look on the web, different short or long experiences, skills, tools, copies of mindfulness that can help you to begin to learn how to do that. Adaptive engaging is a formal treatment that can help when you're experiencing severe symptoms and emotional illness. The research tells us that people experiencing stress and distress more than anything else get a positive response from social connectedness. That is being with someone who will listen, someone who's not telling you get yourself together or get over it when you express difficulty dealing with a trauma or grief. And especially now, as we deal with the COVID pandemic for a long period of time, it's going to be very important to engage with people, peers, in whatever way you can while still keeping safe, using physical distancing, wearing your masks. And so many people have been creative. Have a driveway visit, use Zoom, Skype, texting, and telephone. Build your confidence that you can manage stressful times to adapt to difficult or changing situations. That's what adaptive engaging is. It's really resilience. Traditionally, it's been the responsibility of healthcare professionals to express hope, showing their best selves to your patients. And even in the face of the pandemic, it's still really part of one of our responsibilities. So adaptive engaging also means holding your own integrity, your dignity, and your civility, as well as avoiding toxicity and negative coping behaviors like substance misuse, anger, or violence. And we know these things are unacceptable. So we need to use some cognitive reframing to change our distressing feelings about the situation in ones that we know we can cope with in a more helpful way. And it's really important to create some good cognitive messaging and practice using it ahead of time. I know I can do this. I have my equipment and I'm safe. I have people who support me, whatever positive messaging you can give to yourself so that when you're then in the midst of an emergency, these things will come to you very naturally. Adaptive effective expression involves identifying and expressing emotions in healthier ways rather than just exploding with automatic actions or words that can be harmful to yourself or others. We want to look at expressing emotions in a way that might be helpful to us rather than looking at expressing emotions as being weak or losing control. And again, as we said earlier, there's still stigma in our culture that expressing emotion is a sign of mental illness. Some of us may be concerned about repercussions at work, or we don't want to be seen as somebody who's discontent or complaining, especially in this difficult time when everybody's under the stress of the COVID-19 virus. This is why it's so important to learn to identify what's problematic for you and what to do before you get into these high stress situations. You want to be appropriately assertive in expressing your concerns, and that is that you can state your distressing emotions without inappropriate blaming or displaced rage. Adaptive effective expression involves recognizing what we call prodromals. These are signs or those things that you start to think or do before you become severely distressed, having difficulty controlling your emotions. And we need to recognize that there are people, places, and things, even time frames like birthdays and anniversaries, that may remind us of bad feelings and traumatic events. They can actually make us feel as badly as we felt when the event first happened. Knowing that we might experience being activated or triggered, as we call it, can help us to prepare and plan things that will help to keep the expression of emotion under our own control. And again, these are early and very brief introductions to these different types of tools that might be helpful. There are all kinds of resources that you can see at the Assistant Secretary for Preparedness and Response website, the SAMHSA's Disaster Technical Assistance Center, and the National Center for Post-Traumatic Stress Disorder. And I also gave you the link there to the self-assessment tool, the ProQual. It really suggesting that you seek resources, because what's going to work for one person might not work for the other. We want to make sure that everybody has some kind of resources that might be particular to helping you. So I hope this introduction was helpful. I'm going to pass it on now to Ms. Ullerman so that she can talk a little bit more in depth about self-care.
Okay. Thank you. You might have just seen my baby for a quick second. Thank you, April, for that wonderful presentation. Very helpful, and really wonderful to see the work that we've been doing is quite in line with what you're sharing. My name is Sarah Ailman. Again, I am the Director of Behavioral Health here at the Zufall Health Center in New Jersey. And I have been with Zufall for almost 10 years. It'll be 10 years in August. And thank you to Dr. Leon for inviting me to share today a little bit about our experience with what April was discussing, our experience with COVID, the impact that it had on our staff, and then how we've responded to that. So we are a federally qualified health center in northern New Jersey. We serve 6 different counties. We have 8 sites throughout those counties and a mobile medical van as well as a mobile dental van. In 2019, we served 40,000 patients with around 140,000 visits. And we currently have around 350 staff plus a lot of volunteers. And throughout our sites, we have integrated services, and that includes medical, behavioral health, and dental, as well as many other support services that help us run and help our patients with the care that they need. So Zufall has always recognized the importance of treating the whole person. And in the past few years, this has become even more important in the work that we're doing. In 2018, we were part of 2 different initiatives that really pushed this along. One was the trauma-informed care learning community that we joined through the National Council and Kaiser Permanente. And the other one was that we really emphasized focusing our efforts on integrating behavioral health care into primary care starting in 2018. These 2 initiatives, the trauma-informed care and primary care behavioral health model of integration, really overlap in a lot of important ways with a focus on well-being and safety, both for patients and for staff. And both models help to increase patient and staff satisfaction. Over the years that I've been at Zufall, we've worked really hard to expand our behavioral health services, and with this comes an expansion of staff. I always share that when I started in 2010, I was the only social worker, and we now have 18 staff members in our department. The majority are bilingual English-Spanish, and this includes clinicians, case managers, outreach workers, and administrative staff. We have, at this point, counseling services, including same-day access for behavioral health visits in person or via telemedicine. And I'm mentioning our behavioral health department because the expansion of our behavioral health services, along with our focus on trauma-informed care and behavioral health primary care integration, have all been super helpful in guiding us in our approach to the COVID pandemic. So I'm just going to quickly give you a brief synopsis of what happened to us and paint a picture for our experience in March of this year. As many of you are aware, I'm sure, New Jersey very quickly became a hotspot for COVID-19. At the health center, we had a very sudden and drastic shift in our visit types. We were seeing up to 80% sick visits. People, of course, were not coming in for other types of services. We also, at the same time, did not have any COVID testing available. The medical providers were having to send lots of patients to the hospital who were very sick. And at the same time, we, of course, almost overnight, were trying to transform our practice to mainly telemedicine in order to provide care to our patients. Prior to COVID, we had done a handful of telemedicine visits in behavioral health, and that was it. At the same time, we also had a lot of our staff testing positive for COVID, which is a very scary experience, of course. So all that being said, we know this plays a big impact on our staff. As April shared, in healthcare, there's a lot of stressors every day. And when we have a global pandemic, those stressors are amplified. As I mentioned, we had a lot of staff that had tested positive, a lot of staff that were out sick because of this, of course, staff that were quarantining because of their own exposure, and staff also that couldn't work because of childcare issues. A lot of staff had and continue to express concerns about being in the office, being exposed, how that can impact their physical and emotional health and their well-being. We also had to furlough staff, unfortunately. So we know that this, of course, impacted directly the people who were furloughed, but it also, unfortunately, created for a lot of staff this sense of instability, of fear, of will I be next? What will happen to Zoo Fall? Will we stay open? Will I have a job? And our management did a really good job of trying to ease those concerns, but they were real fears for a lot of our staff. And besides our staff testing positive, we of course had people who were experiencing their own traumas due to loved ones testing positive for COVID and loved ones who have died from COVID as well. As I already mentioned, we had to very quickly transition to telemedicine. And although I have to give kudos to our clinical staff, they transformed very quickly. It of course caused a lot of stress. We also know that in any time clinical staff are hearing our patients' stories, our patients' traumas, the needs that they have. As an FQHC, we are serving a vulnerable population who have a lot of needs and a lot of unmet needs. And COVID really amplified all of that. Our staff were just exhausted and continue to be from dealing with their own experiences with COVID in their personal lives, and then coming to work and having to hear all of our patients' stories and sometimes feeling helpless that they can't do enough for our patients. The other issue is that here in New Jersey, although things have improved, we continue to have a pretty high positive rate and continue to see positive tests coming back, which creates an ongoing anxiety and uncertainty for our staff. So what have we done? How do we try to handle this? We knew really quickly that we had to find a way to respond to the pandemic, to of course care for our patients still, but also how are we going to respond in a way that supported our staff throughout this time? I mentioned trauma-informed care previously because it, as I mentioned, it really helped guide our efforts for how are we going to respond to the pandemic, how are we going to respond to the needs of our staff. And listed here are some of the things that we've done that I will share with you all. We have an internal intranet, and on our intranet, we listed resources that come up as soon as anyone opens an internet browser. That list pops up, and it has everything on there from free resources for kids like online yoga to handouts on how to practice deep breathing, handouts on coping with stress, handouts on different mindfulness meditation apps that people can access. We also very quickly put together some brief stress management sessions. One of our psychologists on our team conducted 15-20-minute workshops during the day so staff could kind of step away from their desk for a few minutes, participate in a workshop, learn a brief introduction to how do I identify stress and anxiety and how can I cope. And he ended it with a brief mindfulness exercise as an introduction to what can we do to take care of ourselves during this time. We also offered with another behavioral health provider one-on-one sessions to staff as needed. We all know that food is always helpful, so we were lucky to have many days where Zoo Fall or other organizations provided lunch and snacks in the office. And although we did remain open for in-office services throughout and currently, we did recognize, of course, the need for social distancing early on, and many staff began to work remotely. So for the staff that were able to work remotely, this was very helpful in reducing their anxiety about exposure. And also for the staff that had to be in the office, it reduced anxiety because there was a lot less people flowing through the building. This also was really important for staff who had other challenges such as childcare. So we had many staff who had young kids home that could work if they were able to be at home but couldn't make it to the office. So as we were able to work remotely, it allowed for many staff to stay on and working full time while also taking care of their family and their childcare needs. A really cool thing that we did in April that I'll share a little bit more about was a self-care contest. This was actually done through our sexual assault support program during Sexual Assault Awareness Month as a way to promote self-care always, but particularly during the time of the pandemic and how important it was. And we asked staff to submit pictures of themselves practicing self-care, and there was a contest where they could win, I think it was a $25 gift card. We had a really great response from staff and a lot of positive feedback on that activity. As April mentioned, something else that's been crucial for us has been technology, staying connected. Being that we are all more distanced than usual, we're not holding in-person meetings. Some staff are working from home, some are in the office. We've been using Zoom and Microsoft Teams as much as possible, doing video meetings. That way we can all physically see each other and stay connected throughout this time. We also have a lot of staff who have been working continuously to identify resources for patients. And this has been really important because it's been a way for them to help patients, but also for the clinical staff, it's been a way for them to feel that the needs of their patients are being met. So we had staff dedicated to finding out where are the local food pantries, how can we get food delivered to our patients who can't leave their home due to fear for their safety or because they've been tested positive and can't leave the home because they're quarantining. So we have a whole system in place where food was being delivered to the health centers. We had volunteers bringing food to patients' homes, all different services around food delivery. Also, of course, helping people apply for financial assistance. Another thing that I'm super proud of, we started a Spanish-speaking bereavement group for anyone in New Jersey who lost a loved one due to COVID. We saw that there was an English group happening through another organization and knew that there was going to be a need for Spanish-speaking support. So we offered that group to anyone, not just patients of our health center, at no cost to the patient. We just completed our first group last week, and we are in the middle of our second group, and we will continue that group going as long as we have people who are interested in participating. So I also really cannot say enough about how important open and regular communication has been, especially with us distancing. Really from the start, our senior management put out a SurveyMonkey link to the staff, basically asking them, here's what we're doing, what else do you need from us? And it had some options and open section where they can put in other ideas. And we left that SurveyMonkey link available throughout this time. So at any point, if someone had a thought or an idea of how we could help them more, people could respond to that. Our CEO also sent weekly updates. We've been having our trauma-informed meetings and clinical staff meetings every 2 weeks instead of monthly, and in this way providing support to each other, discussing cases, exploring how can we help staff and patients more. And we also have been taking time at each clinical meeting to acknowledge our patients who have died from COVID, which I think has been really important for the staff to be able to have that space to debrief and have that conversation. Another really important thing is appreciation. So thanking each other whenever we can. We've sent out emails, and every meeting we're at, we thank everyone for what they're doing. Our CEO has continuously thanked us for our hard work during this time. We've also received a lot of wonderful thank yous from our patients. And going back to what April shared about being mindful of why we do what we do and why we're here, getting that feedback from patients, I think, has been so beneficial in reminding us of why we're doing what we're doing and what the benefit is. We've had patients share with us, we have a very big Hispanic population, and some of our patients have shared that they know that in their country that they're from, they wouldn't be getting care. So they're grateful that we're open, that we're here, that we care about them. And that feedback has been really, really crucial. Something else that we're working on that I didn't list here on this slide that will hopefully come out in the next week or so is another video from the same psychologist who did those stress management workshops that's geared for our staff, talking about how to recognize stress and anxiety, the importance of healthy coping skills, of self-care, and then also a brief mindfulness exercise. And we want to do this because we know that we have staff that are returning to the office who have not been here in 3 months. We also have staff who have been in the office but now have to experience being around a lot more colleagues and a lot more patients coming into the building. And then we have ongoing anxiety for all staff because, as I mentioned, we are still getting positive cases. So this is just a few examples of the work that we're doing. On the left-hand side, you can see the flyer that went out about our self-care contest. In the middle is the intranet links about different self-care and important resources available to our staff. And on the right, I'm sorry for the blurry picture, and it is in Spanish. This is some messages from patients. We sent out a message through our platform that we were able to send a text blast out to our patients, basically saying Zufall Health is here. We care about your whole health. We're open for telemedicine visits. Call us if you'd like to schedule an appointment. And we got a lot of wonderful responses from patients just saying, God bless you, thank you for caring, thank you for being here, good luck, keep safe, things like that, that were really wonderful and powerful messages. And I'm just going to finish up, I'll ask Fide to pull up on the screen a video of the self-care submissions that came in from our staff.
Thank you, April, and thank you, Zara, for your great presentations. All the information that you provided is very helpful for health centers and for the healthcare professionals taking care of special and vulnerable populations across the country. So we're going to start our Q&A session. If you would like to ask a question, please either use the question box on your control panel and type your question, or you can use your phone or your hand raise icon, and your phone will, and your line will be unmuted. Also, if you go to the control panel, you will see the handout. You can download the slide deck from GoToWebinar, or after this webinar, you will receive an email from the National Center for Health in Public Housing, and you are going to get the link for the recording and the slides and the resources that the panelists used for these presentations. Thank you so much. And Fide, do we have any questions?
No, not at the moment.
Not at the moment. Okay. Well, we wait for any questions. April, this is we were talking before the webinar about the COVID-19 pandemic and how this new event has put a lot of stress on everybody, not only the general public, but healthcare professionals in general. And this is an event that is going to last for more months. I mean, we don't have a vaccine, we don't have treatment, and the stressor are going to continue. You know, what is your recommendation for those taking care of patients when there is an event that is going to last, you know, for more months? Or I'm not sure, and nobody exactly knows it, how long this is gonna last. But what is your recommendation?
Yeah, it's a great question. Dr. Leon, because we do know this is going to be a long time. Even a matter of months is a very long time to stay at a very heightened state of distress, fear, and anxiety, especially for healthcare workers who know that patients and clients depend on them and that they have to function at their best. So some organizations have been implementing a number of different ways to help relieve some of the stress, especially if they have mandated like 12-hour shifts or back-to-back shifts, or changed people's schedules in such a way where they're doing longer periods of time. So some are doing a 45-15 schedule where anybody who's doing 12 hours or longer in a shift works for 50 minutes and then has to take a break for 10 or 15 minutes and do some physical exercise. They're providing a space for them to walk either in a courtyard or in the nearby area. Making sure that they have snacks and hydrate. You know, you can be taken out of functioning well just because you haven't had enough water. And I think that Sarah's point about healthcare provider organizations bringing in things like food and water to make sure that people don't have to go looking for that or worrying about that, especially if they've got a short break. But also then having quiet places for people to go and relax, sit down, meditate, or stretch, or do anything that will help get the stress hormones out of their body. So a combination of these different things. And for the management to really implement it, Dr. Leon, this is one of our biggest issues, because if management doesn't model these things and provide the kind of structure, again, you'll see healthcare workers just continuing to run themselves ragged. And again, they can be taken out and become sick by not hydrating properly or by having their immune system drop, which of course is going to make them much more likely to experience the COVID-19 virus. So we really recommend at an organizational level implementing all these different kinds of healthcare activities that staff are then really expected, supervisors, managers, administrators, to walk through the hospitals, walk through the qualified healthcare centers, and make sure that staff are in fact taking a break and not rolling their eyes when they go outside to take a walk, or if they see them in the break room instead of at their desk with their lunch or their breaks. So it really does need to come from the top down. And for human resources and managers and administrators to be able to introduce and then implement these kinds of things that we know can help people. And we're also recommending we kind of go back to the 80s when all the staff were involved in peer supervision groups. They were all invited to grand rounds so that they can learn things from the physicians and other subject matter experts, and bringing opportunities for the staff to learn together so that they can function better together and also to take care of each other. And of course, pushing that there are EAP services available to those who are really starting to experience some severe stress, or if they have some personal stress problems going on that they might need to talk with someone about to do some problem solving. So there are all those kinds of things that we suggest that the organizations as well as individuals try to implement.
Thank you, April. That's a great.
Dr. Leon, I'd just like to add, if that's okay, quickly. I think what April said is so important, and also to keep in mind, you know, I've heard a lot in our facilities of people saying, myself included at times, oh, we've adapted to this new normal. We don't feel like we're in this state of crisis, and that's fine. But the concern with that is that we kind of let down our guard and stop putting in these extra protective factors. So I think it's so important that we keep in mind what you're saying, Dr. Leon, that COVID isn't going away. There is still concern. There is still trauma coming from this, and we need to provide those extra supports to our staff for the long term, not just when we were in the beginning of this pandemic.
Thank you, Sarah, and thank you for timing on this particular issue. You know, because I was going to ask you, like, one of the concerns I have with healthcare professionals, including me, is that sometimes we have some type of denial. You know, that we see the problem that we have. We are experiencing some kind of stress or anxiety, and yet we believe that we can live with it or handle this issue. So, question, I'm sorry, Sarah. Is there any policy at ZUFO, regardless of any provider or clinician, saying that they are okay, that they have to somehow, you know, have some kind of relaxation or break So making sure that they're keeping their mental health, and not experiencing any other mental health issue.
Sure, that's a great question, and something that we of course have experienced here. I think we were, in the beginning at least, I can say I was surprised when we reached out to staff, and our chief medical officer reached out to the medical providers, who all kind of said like, oh, we're okay, we're dealing with this. But it is a way of coping, right? Of just saying I'm okay and pushing it down and keep going. We don't have a formal policy in place around that, but what we have done is when we offer things like those stress management workshops, rather than just sending an email to the whole organization saying, feel free to participate, we, after the first round of doing that and recognizing a lot of people didn't participate, we took it to the next level where we had managers and site managers go directly to staff and say, we're really encouraging you. What time would you like to sign up for? So to make it a one-on-one interaction and really encourage people to participate rather than an email that they may or may not see or may choose to ignore. So we're trying to do things like that, and also incorporating relaxation things in different meetings or gratitude conversation in our meetings. So we're incorporating it into mandatory meetings. So in an indirect way, people are getting that knowledge and that information.
Brilliant.
Excellent. Thank you so much, Sarah. Are there any questions in the queue?
No.
We don't have any questions. Well, we have it's to 16 p.m. So if you have any questions or you would like to ask any question to April or Sarah, you can send it to us, and we're going to make sure that they receive the questions and you get the responses back from April and Sarah. Feed the next slide. So remember to please complete the post survey after this webinar. We have an upcoming webinar. This webinar is for public housing agencies and public housing primary care grantees or health centers located in or immediately accessible to public housing. It's going to be on June the 24th at 1 p.m. Eastern time. Next slide. So please complete the post survey. Next slide. And visit our website, www.nchph.org. You will find additional information on training and technical assistance activities. Next slide. You can also join our mailing list, and you will receive updates and information from HRSA and other federal organizations and on emerging issues and funding opportunities and other programs from HRSA and HHS in general. Next slide. This is our contact information. You can call us at 703-812-8822, or you can contact via email any of the staff members of the National Center for Healthy Public Housing. Once again, I would like to thank April and Sarah and all of you who attended this webinar. Have a great afternoon. Thank you.
Thank you, Dr. Leon.
Thank you.
Thank you.